With everyone having so many questions about digital wallboards, I decided to make a call myself to Outcome Health to figure out what the heck is going on. Hello, my name is John Lin. I'm a urologist in Gilbert, Arizona, also your humble host of the Thriving Urology Practice Facebook group. Someone posted a question about digital wallboards and where do you get it, what it's all about. So I looked into it myself. This company used to be called Context Media, and Context Media actually purchased Accent Health. They rebranded themselves, and now they're called Outcome Health. And I put the link to their website in the video description if you want to visit them. I spoke with Liza today, who gave me the inside scoop on how to sign up and what is all involved. All right, so you have to qualify with an NPI, and it takes about 10 days. They'll ask you a series of questions, and they will qualify you. Within 10 days, they will let you know if you qualify, and it is not available to pharmacists or dentists. It is only available to physicians, MDs, DOs, and they also want to know how many APPs you have, or advanced practice providers. The installation, once approved, the installation takes about 30 to 45 days. And then it comes in various different formats. There's a specific format, a specific hardware for infusion centers, but as urologists, we obviously won't need that tablet. And what's available to us are tablets for patients in exam rooms, digital wallboards, and also televisions that you can put in your reception area. So when it comes to tablets for patients, you would have them in the exam room, and the patient would look through the content by holding the small tablet. You can load videos, short videos, custom videos that you create on these small tablets. And then the wallboards are mainly for anatomy. You cannot display videos. You can have flyers that show up on your digital wallboard, the big old wallboards that you mount in the exam rooms. They're mainly for anatomical purposes, for you to show patients different anatomy and for illustration. So it's not really to show a lot of videos and advertising, if you will. Lastly, the television that they can provide in your reception area, it does show video, it does show flyers, and the videos that if you decide to create videos, you want to keep them nice and short, maybe no more than 3 minutes or so. All right, the content on these various hardware platforms, they're updated wirelessly, and the loop on the content is every 2 hours it'll loop. So if the patient's there for longer than 2 hours, they'll see the same content, but hopefully none of your patients are in your exam rooms or in your office for more than 2 hours. The content is updated monthly. So they will put new information on the various platforms, the different ads, different public service announcements, and they'll update that wirelessly every month. That is the scoop on the hardware and what is displayed on them. You can put custom content that you create. However, the big caveat is you cannot mention Da Vinci, you cannot mention brand names like Da Vinci or Cool Sculpting or Urolift or Urocuff, Avid, Xtandi, Pfizer. You can't use any brand names, because Context Media, or not Context Media, Outcome Health, they make their money on advertising, and obviously they want to be able to control the ad content on the devices that they put in your offices. There are some guidelines on custom content, and that is mainly it. You cannot use any sort of brand on your content. You can say, hey, talk to your doctor about robotic surgery without mentioning Da Vinci. Hey, talk to your doctor about minimally invasive surgical treatment for BPH without mentioning Urolift. So things like that. And the content that they display on these devices is urology specific. So you're not going to get advertising for OBGYN in your office on one of these devices. Lastly, if you want to create custom content for your devices, it takes about 10 days for their team to upload it. All right, guys, if you guys have any questions about Outcome Health, visit their website at outcomehealth.com. And I'm sure if you click on the contact us link, you will be able to reach someone as helpful as Liza, someone I spoke with this afternoon, and she will give you the full scoop on how to sign up and take your information. Any comments or questions, leave them below, and hope you have a great day. Take care.